Hello, everybody. Good afternoon. I hope everyone can hear me clearly and is ready for a great session. I'd like to welcome everyone to the second session on the opening day of How Can We Dismantle Health Inequity Together, which is the National Voices Conference to realise the power of the voluntary sector. And this session is poverty and mental health, as you can see, exploring the problem. The context of the conference today is poverty, which arguably plays a part in most of the social determinants of health. And with the economic, social and personal pressures the lockdown is bringing, we're going to spend the next hour with three people whose work and experience in these areas can throw real light on what these enormous challenges look like on the ground, particularly in and around the area of mental health. And I'm delighted on National Voices' behalf to be welcoming our panel, Amy Wells, who's Communications and Membership Manager at National Survivors User Network, Andy Bell, who's Deputy Chief Executive for the Centre for Mental Health, Maureen Ndawana, Community and Engagement Officer for the African Health Policy Network and Coordinator at FINA. We'll be hearing from them in this session about the work they do and exploring some of the issues they keep coming up against. We will be taking questions after they've spoken. And you can do this via the Q&A button that is at the bottom of your screen, as this helpful graphic shows. So that's the place for questions. The chat, jump in, introduce yourself, make your opinions known, that's great, but questions are best placed in the Q&A function at the bottom. Captions are available too down at the bottom. And you can tweak how those look for your needs as well, and hopefully you can see that too. We'll also launch an interactive exercise after a bit. This is using the Mentimeter technology, which if you haven't come across this before, we're going to be using one basic function, and that's to ask you a question, and it'll hopefully prompt you to put in a couple of words, and we're going to make a fabulous word cloud out of that and have a little discussion about that later. If for you don't want to do any of that, that's absolutely fine too. Sit comfortably, listen and watch, and whatever you're comfortable with, because we want everyone's focus to be on the subjects we're exploring, and you know what works best for you to do that. So to start, I'd like to ask Amy Wells from National Survivors User Network to kick off proceedings. So Amy, the virtual floor is yours.
Thanks very much, Charles. I hope everyone can hear me. Yes, thumbs up would be great. Can you? Great, wonderful. So yes, thanks very much for having me. I'll start off just a 5-minute kind of overview of some of Enson's work in this area. So yeah, just a quick intro from me. I'm Amy. As Charles said, I am the Communications and Membership Officer for Enson. Enson is the National Survivor User Network. So you might not have heard of it, but basically we're a mental health charity and a membership organisation run by and for people with lived experience of or survivors of mental distress, ill health or trauma, as well as grassroots user-led mental health groups. So in this session we'll be talking about poverty and inequality and mental health, and later we'll be talking about some of the evidence surrounding this, but what I'd like to focus on are some of the gaps in how we view the cycle of poverty and mental ill health and distress. So this is going to be a specific policy focus for Enson over the next 3 years. We recently conducted a survey and a focus group to kick it all off, so I'll be sharing a bit about what we found, which was both surprising and not surprising. So if I could have the next slide, please, Chris Whitty style. So this is a quote from an Enson member that kind of sums up the essence of everything I'm going to be talking about pretty well. So if a person has enough money to choose where they can live, go on holiday even once a year, to eat good healthy food, to not have to work 2 or 3 jobs to keep out of debt, then they're going to have a much more comfortable, peaceful and happy life. So if I could have my next slide, please. Thank you. So yeah, so specifically, obviously that kind of gave us a bit of an overview, but what were the specific things that our members told us about when they were talking about what they termed the vicious cycles or the poverty trap that intersected with mental health. So work and lack of work was a big one, and that covers being out of work because of your mental health and finding it hard to get back into work, which can often leave you in precarious or casual employment, and often unable to pay the bills, which creates more mental distress. Or it's about being in work but not having your needs met, and being vulnerable to being exploited or discriminated against, again, which creates more mental distress. And then housing was another big thing that came up. So 4.3 million homes in the UK don't meet standards defined by the government's decent home standards, and there are over 800,000 people living in overcrowded accommodation. So lots of NSONS members live in unsafe housing. Often they've got problems with mold, rats, that kind of thing, overcrowded estates and poorly maintained council housing. And that prevents people in a lot of cases from feeling like they can better their lives and their mental health. And it's marginalised and racialised communities that are overrepresented in some of the poorest parts of the country on a local level. The benefit system, again, comes up a huge amount for our members. They've told us about the system being inadequate and insufficient to support them, and they describe the system as hostile, dehumanising, and punitive, with its assessments causing a lot of stress and anxiety. So it can go a long way to making people feel like a burden, and they have to prove that they're worth helping. And then finally, the other big thing that always came up was debt, which is another kind of trapping part of that poverty cycle. Another one that causes a lot of fear and anxiety, which doesn't help with like hope for the future. You've got to live day to day, and that makes being mentally and physically well less possible. And the stigma that surrounds that, or the shame that surrounds being in debt or being in poverty, isn't something that's equally experienced by all communities either. So sometimes there's still a bit of a lack of understanding around the fact that mental health doesn't exist in a vacuum, or when we talk about how mental distress, deprivation and inequality interact and compound poverty, we can get stuck in that kind of abstract and in statistics, which are very important for changing policy, but that also has gaps. So in our conversations with members, they talked about what's most important, which is the detail of their lives. So I've got 3 more quotes to share with you from our membership themselves that illustrate what I've just been talking about. So I've recently moved into a flat on my own, thanks to help from a family member, but previously I was living in a crowded house share with strangers, which was horrific and worsened my mental health no end. So that kind of illustrates issues with housing. The next one, I am so terrified of debt, I'd rather go cold than run up heating bills, not use my gas boiler to run central heating in about 15 years because of the cost going up and up every year. Wear a coat, hat, gloves, slippers indoors when it gets cold, go to over the hot water bottle, have no one who could or would help me if I got into debt, so I just do not spend any money if I'm fearful of not having enough. And then my final quote, I grew up in extreme poverty and had mental illness my entire life. I fell into the benefits trap and couldn't get out as I'm too unwell. My illness and not having a good work record crushed my confidence. Being on benefits for years is an awful feeling. Being a pariah, stigma in society makes me more unwell and I'm stuck. It shouldn't be like that. So obviously this isn't the most cheerful topic in the world, so I apologise for those, but I think it's really important to share what people's real experiences are of this. So finally, from me, on a more positive note, what does this point to in terms of what we need to do to reframe the conversation around poverty and mental health? So I think it's about the need to advocate for smaller, more specific policy changes in multiple areas. And some of these might be kind of way outside the traditional mental health policy domains, but they impact on it greatly. They need to talk about poverty at a more granular level, but also with an intersectional lens. We can't talk about mental health without talking about the material conditions of life, having barely enough money for survival or for nutritious food, of the things that make life worth living, creates environments in which people become unwell or can't get well. And finally, having conversations about poverty and mental ill health and distress need to be informed by and led by lived experience of both. And that is it from my brief presentation. I'll pass on to Andy now, I believe.
Thanks, Amy, and it's great to see such a good and interesting group of people here, with people introducing themselves on the chat. So my name's Andy. I work at Centre for Mental Health. If you've heard about us, well done. If you haven't, where have you been for the last 30 years of our lives? And we're a research charity, and our work is dedicated to reducing inequalities in mental health and tackling things at source. So last year, we carried out a major exercise called a Commission for Equality in Mental Health, and we were looking at what would a system designed for mental health equality look like, rather than always accepting the view that poverty and inequality and poor mental health are always linked and always going to be with us. How could we design ourselves out of that, and what would need to change at a national level as well as locally, and everything in between? So what I thought I'd do today is share some of the headlines from that relating to particularly material poverty and inequality. So here we go. Next slide, please. Marvellous. And really, I think, completely agree with Amy. I think we're going to break out in agreement here today that what's really obvious when you look through the evidence is that mental health inequalities are social and economic inequalities. The things that divide us and treat us unequally are absolutely the things that harm our mental health. And indeed, further to that, particularly for any National Voices members whose interests are predominantly on physical health, really important evidence that it's poor mental health that's often the link between material poverty and injustice, and poor physical health. It's poor mental health that very often drives people into later physical health problems too. But crucially, and again, I think we're going to break out in agreement here, we see two dimensions to those inequalities. The first is inequalities in wealth, and I use wealth really advisedly here, because this is about different resources, not just about income. But both poverty in itself, absolutely, and inequality drive poor mental health, and more unequal societies have higher rates of mental ill health. So if we as a society think we want better mental health for all, which I hope we do, steps that reduce inequality will actually reduce the total number of people experiencing mental ill health. But of course, this intersects, as Amy said, with power inequalities, whether that's due to racism, misogyny, homophobia, any kind of acts of violence or oppression or injustice drive poor mental health. Don't worry too much about the graph at the bottom. I'm happy to explain that if people want to, but not in 5 minutes. Next slide, please. Oh, sorry, next slide, please. There we go. So in case you need me to prove the point, here are two maps. One of them shows levels of deprivation, and areas of the country with higher or lower levels of deprivation. You can kind of work out it goes from dark blue to a rather sad beige. And the other map is levels of particularly depression and anxiety. You don't need to worry too much about the detail. You can look for where you live if you want, but the crucial point here is look how close they are to one another. It's almost impossible to distinguish levels of deprivation and levels of common mental health problems. So this is a huge geographical inequality, but of course it affects people in communities too, and even in relatively well-off areas, being poor, being excluded, in some cases can be even worse. Next slide, please. So what would a system designed for equality look like? Well, these are some of the elements that we thought of in our report. Do have a look at mental health for all. I'll stick a link in at the end. But inevitably, you can't do this at just one level in one way. We need the whole system working towards equality. So we need to think about what happens in children's early years, and particularly in school and college. We need to look at how workplaces can have more of a just and appropriate way of working. We do need to look at economic inequality, and I'll come back to some more detail on that in a minute. And of course, we need to pursue racial justice. And in a country where we still have hostile environment policies, and we still have workplaces where people's rights are not as they should be, and schools where children are being excluded on a growing basis, even though we're just coming out of a pandemic, mental health inequality is always going to be harder to tackle. So next slide, please. And this is perhaps the most important one that I'm going to show you, is just having a think about what are those changes that we can say with good evidence would make a difference. The first is we really do need to take steps that reduce the wealth gap. Living wage policies, both nationally and locally, can make a huge difference. I love the fact that Lambeth Council made itself a living wage employer. It persuaded its NHS partners to become living wage employers, and now they're going out to their colleagues in the private sector to say, will you do the same? Will you match that? Imagine if that happened in every part of the country. But we should also be looking at universal basic income policies. They're controversial. They may or may not be effective, but they're certainly something which is gaining traction. And actually just paying people more in benefits. The value of means tested benefits in particular has gone down and down and down with every decade. And that's putting more and more people into poverty. We also need a benefit system which is less combative. Why is it that people are forced into awful assessments that demean and diminish them? Why is it that people are forced to go through certain activities or have their benefits taken away? But something the NHS can do and local authorities can do is make sure you have really good quality welfare advice so people are at least able to get what they're entitled to now. Inevitably, we need to improve employment support, particularly using individual placement and support because it works. We must focus on youth unemployment now because we know that has a long-term impact on mental health throughout people's lives. We need workplaces where employment protection policies and workers' rights are looked after. And exactly as Amy said, we need to secure warm, safe and properly secure housing for people. It has a direct and specific impact on mental health. I think that's it from me. The next slide gives you a link to our website and the report that I've been talking about. Thanks for letting me be part of this. Looking forward to the conversation.
Thank you. Go on, Charles.
Thank you, Maureen. I was going to say, go ahead.
Oh, okay then. Thank you. Hi guys. Good to see everybody, and thank you so much for inviting me to come and have a little bit of a chat with regards to how African or migrant communities are impacted by poverty levels and mental health. I'm just going to say a little bit of insight of the work we do. I'm from the African Health Policy Network, which is an umbrella organization working with Africans living with long-term conditions in the United Kingdom. And most of our members are living with long-term conditions like cancer, diabetes, HIV and AIDS, you know, quite a lot of them anyway. So these people are people from African origins, and they migrated from Africa into the United Kingdom with the expectancy of living a better life. So I'm just going to touch a little bit of what they go through, which leads into our topic of discussion today. Migrant communities, which what contributes most of them, they are people who, by the means of just migrating from one country to the other, they are impacted by disempowerment. So they can't speak up. They feel less privileged. They feel they don't fit in easily. So there is an issue of language barriers, English being their second language. And that means they can't comfortably fit in whatever services that are there with them. And there is a bit of stereotyping which goes on, especially the stigma and the discrimination because of their color or wherever they are coming from. And they feel like they don't have a right to speak out or to freely express themselves. So this lack of confidence as well, to have a voice due to cultural issues arising from the countries where they are coming from, the less understanding of the criminal justice and discrimination, lack of transparency in legal issues, how to go about anything that they might want to go through. Also the social pressures. Whilst they moved away from Africa, coming to the United Kingdom, and it's all about going for greener pastures, and yet the pastures are not that green. So when they come over, the next thing is they find that they have to work, and the kind of work they have to go into, even if they've been they had better jobs in Africa, they cross over, all that is not considered, especially we've got doctors who've migrated, then when they came in here, they expected to go for some adaptation and things like that, and yet they have left high levels of poverty coming over, thinking they'll just start on getting onto their work, but they can't have that privilege, the advantage. So the next thing is they just go for care work and less deprived of their intelligence, even if they are more qualified over there. But here, nothing like that is considered. So when they cross over, they start working. And most of the time, the living conditions, they start sharing houses. Most of them, they are 9 people in 1 2-bedroom house. And each of them, if you notice, most of them, they come out, they have to go and work. And most of them, when they manage to upgrade themselves by getting their own accommodation with their own families, maybe they got 2 kids or so, and the high rise of rents. So now that means they have to subsidize by going and get a second job. By so doing, they are working in a second job. They don't have much time with their families now. They don't have much time with their children. And hence, these children now, they are the ones, they go out there because they don't have much guidance. They go out there, they get themselves involved with social, doing things that they are not expected to be doing. And these are the children that we find, most of them, they are in incarceration, they are in prisons, they fill up the prison because there's lack of guidance. Why? Mom is busy chasing after shifts. She's working very hard so that she puts food on the table. She has to pay the bills. In the African community, if you are someone who's got so much debt, it's quite a taboo, really. You are not expected to do that. It's an embarrassment. It causes so much shame. You are stigmatized because you got so much bills or debts to cover, but yet they are expected to work. And that means this family now is so much fragmented, so much that they have to work. The kids, even sometimes they can't even concentrate at school. And now, as a parent, it takes them to be like too much to deal with, and they get so frustrated. At the moment, we are working with a case whereby one lady, she came into the country, she worked so hard, managed to bring the kids here, and she is working now, managed to develop herself, went into nursing, but now she is managing to have a 1-bedroom flat, which she brought all the 2 kids in here. But now, because she's chasing, she has to pay all the bills and everything. Now these kids, because of the lockdown, they are always by themselves in the house. Mom is always at work, comes back at night, or she goes on night shifts. Some of them are even doing double shifts. And then mom, all of a sudden, the girl is pregnant. And the question is, who got the girl pregnant? It's the brother. And now you can imagine how it feels to the mom now. She is everywhere. Instead of her sitting down to discuss this, she feels so pressured that she can't share. And it's shameful. What the kids have done, it's shameful. And then we as service providers, we are expected now to chip in, try to calm the situation down. Sign posters to services, for counseling, for social services. Everybody is involved. And by so doing, it's even making more than the mother more vulnerable. She feels she can't handle it anymore. Now, as we speak, she's taking antidepressants. She's got serious mental health, and now she's actually been diagnosed with this mental health, and she is not fit to work. That means everything has come down to the lowest level. So now, these are some of the small issues that we are meeting with the community that we are working in. Most of them, especially the older generation, they used to work, but now they can't work. Why? They're living with long-term conditions now. They got HIV, they can't deal with it. It's the stigma involved, the discrimination. Even if they want to go to work, they can't work because of their age. And now what is happening? They are isolated, they are lonely, they are in there, they expect help. And as service providers, we're expected to chip in again and try to help. So these issues, and it's just a little bit of what we are working on right now. And especially with the pandemic that is going on. It's really, really difficult, but we are trying the best we can to work with them individually and addressing these cases here and there and signposting. And now we're talking about services, so many services have been cut down, and we are providing them. For instance, counseling. Yes, of course, we are trained. I've trained as a counselor, but you find that at the end of the day, you are now a service provider, and yet you are expected to do some counseling as well. But because this has to be done, and this is what the level of poverty entails within the African communities. So we are looking at now, what is the way forward? The way forward is we need to bring these people on board. Whenever we have platforms like this, let's bring them as well. Let's include them. Let's hear from them how they feel, they feel about being lonely and isolated. And now most of them, I even always talk about the implementation of using technology into accessing services. These are older women. Now they don't want to know about all this, even if we try as much as we can to train them to use the gadgets and to log on to hospital appointments and things like that. They don't want to know. Why? Because now the level where they are is even worse than the level where they've been when they crossed over to when they migrated to this country. So you find that it is a challenge also for us as service providers. So that's when I always say, whenever we have forums like this, let's invite them, let's bring them in, so that as well as they are in there, we are including them. They feel the confidence, they feel the confidence, they are empowered as well. They speak out how they feel, they speak out how this level of poverty is, affecting their lifestyles as well as their children. And we also involve, I would really wish that next time when we have these meetings, let's involve the young people. These are the generations to come. They need to hear this, or else we'll end up being in a vicious cycle. Doing the same thing all over again, and it's not helpful. So maybe next time it would be nice to have this on door.
I think we all completely agree, Maureen, and thank you for that. I think if we could, I think we could we're running this conference for a month over four Tuesdays. We could probably fill every day.
Yeah, that would be great. Thank you.
Hopefully we'll be fortunate enough to get the funding to run another conference with young people and lots of other groups as well. But we're trying to get everyone in, and thank you for that. That was really powerful. Thank you guys for everything you said. There's some difficult things to hear there, and some big challenges as well. And we've got a few questions to ask, but first we're going to pop over to the Mentimeter. We have a question for everyone. You're going to get a box that's going to come up, and you can put 2 or 3 suggestions in it, just 1 or 2 words. And I'm going to give you the question now. The question is, where does the focus need to be to support people living with poverty and mental ill health? So I'll repeat that. Where does the focus need to be to support people living with poverty and mental ill health? So if you could just pop the link has appeared in the chat. If you click on that, you'll be able to put in a couple of words, and then you can come back to this screen and we can carry on. That hopefully will give us a general picture, a visual representation of how people view what is a very, very important question, but a very difficult one to answer in very short number of words. So we have a couple of questions, and one I've got for Amy actually specifically. You were talking earlier about some of the things that your service users talk to you about, and you made a point about talking about poverty at both a more granular level and with an intersectional lens. And obviously the difficulty here is obviously we use terms. Sometimes it's interesting to look behind those terms and look about what that means in more real terms. So yeah, could you just broaden that one out a little bit for us?
Sure. So in terms of looking at it at a more granular level, I think that kind of means picking apart the bigger picture, not just to think, okay, if somebody is in poverty, it's like somebody's in poverty, why, what are the specific interacting parts of their experience thus far that's caused them to be into poverty, what is the impact that it's having on their mental health, kind of thing. So basically not just looking at it as like this broad topic that doesn't have lots of social and material factors behind it, and that doesn't have lots of kind of like moving parts that often like compound themselves year on year, that kind of thing. So it just sort of means, yeah, looking at poverty as less of a one size fits all thing, and at more of like a lower level. And then in terms of intersectionality, that means so looking at parts of a person's social identity, like how those parts interact basically to cause varying levels of discrimination or deprivation. So like obviously lots of people have parts of their identity that cause them to be marginalized, and I mean they often play a part in each other to be like a kind of triple barrier to things. So I know the Centre for Mental Health like talks a lot about like racism and poverty being a you know, interacting barriers towards getting the right support and that sort of thing. Yeah, so I think it's just about like always addressing marginalization when we're thinking about poverty, not just like in basic words, not everybody experiences the same level, the same factors that might drive them into poverty, into unemployment, into physical illness. People have varying levels of privilege that allow them to not live in deprivation and that kind of thing. So yeah, that was probably a bit of a waffly answer, but looking at things on a kind of smaller level, seeing what the parts are, and also always thinking about what different parts of people's identities are interacting and compounding things that other people might not experience that push them into poverty.
And of course, National Voices is all for looking at the personal in all of this and how that affects people on the individual level. Andy, I'd like to sort of do something similar with you, actually. You talked about the system and system change and the need for redesign. And obviously, there are big challenges. It would be great to know if you could you identify a couple of sort of priorities in real terms where you could see the possibility of change that could really start making a system that works for everybody.
Yeah, I mean, everyone will have views on that, and I've seen some great views expressed in the questions and the chat as well. And I think sometimes we get kind of held back by the feeling it's all too big and too huge, and it's the fault of government, so therefore there's nothing we can do. And of course, we do have to lobby government. We do have to kind of keep making the case, for example, for continuing the extra £20, I mean, £20 for goodness sake, of universal credit and other benefits as well. Really important that that's extended to all people. So we do have to keep lobbying for kind of national action and a cross-government approach to better mental health for everybody. But I think we've seen some really good examples of steps taken locally. So the Lambeth Living Wage piece of work is a really great example of that kind of anchor institution role. Anyone working in the NHS or local government, you buy a lot of things in your local economy, or you can. So how you employ people, making sure that you employ people from the local community, making sure that you're encouraging your supply chains to pay the living wage, making sure people are getting enough money coming in. These are all things that can happen locally that can make a difference. But I think also working with community-based organisations, often they have some of the answers that statutory organisations don't. So actually having a real partnership, funding those organisations for a proper period of time so they're not spending all of their time filling in funding applications would be wonderful. We still have what one of our commissioners on the Commission for Equality called a class system in charitable funding. So charities as well, big charities in particular, can look at how they're giving out grants and how they're using their charitable spend to support particularly smaller and community-led organisations. So there are things that we can all do to make sure that the system's working better for people without losing sight of the fact the system is inequitable and needs to change as well.
Yeah, That's really interesting to know, and I think we get a picture of a little insight into your work there as well. Maureen, I'm interested in the stories that you're telling, and something that Amy brought up. I think it was Amy, about power and these imbalances in power, and how people are not feeling empowered, and it creates this sense of insecurity that seems to be running through a lot of what we're talking about. What's your view on that? Do people feel disempowered? Talking about people coming from different communities where they're already moving away because they feel disempowered.
I know. I mean, the main idea, the main problem here is what makes them feel so disempowered is that they are not listened to. And the moment they feel like no one is listening to my cry, my pain, whatever I'm going through, what's the point of me sharing what I'm going through? So they just will be quiet about it. Yet in a way, they are actually putting a barrier between them, and even they can't even influence policy. Why? Because they're just quiet. So there is no voice there. So with the organization that I'm working with the group of women and men that I'm working with, we try to empower them, make them strong, make them confident that whatever they say, someone somewhere is there will listen to them and might create change because of that small verse, that small stanza, that paraphrasing they've done. Someone will be lucky enough, somebody who's going to be listening to them, and they might influence change about that. So we need to learn to listen. When we listen, we are actually empowering people to speak out because they know very well that this will influence change.
Thank you for that. There's a lot of support for you, by the way, Maureen, in the chat. Somebody's even asking for you to go into Parliament. So there you go. I assume that you could take that either way, I think, sometimes.
I will take
I think they mean in a good way.
Thank you.
And
Thank you.
Talking of the chat, and I think you just referenced it, there's some mentions of levels of mistrust with agencies. There's some chat about landlords, the price of rent, private landlords, things like that, and a lot of people concerned about young people as well. And I'm sure you all do a lot of work, as I know you do, with young people, and we're all concerned about that. I'd like to ask a question, to throw it open to all of you really, is how you think the voluntary community and social enterprise sector organizations can move relatively quickly, from where they are to where they want to be. What are the issues that are facing those organizations, and how can they free themselves of some of the chains that are tying them down? Someone jump in, go on, be brave.
Happy to give my 2 cents. So I think we represent a lot of groups who are kind of like newcomers to the voluntary community social enterprise sector, in that they're very much like grassroots groups that support the mental health of people in their communities, but work holistically. So very much a lot of them won't even explicitly define themselves as mental health groups. They will be working around social isolation or inclusion. A lot of the time they're people united by parts of their identity that form the sense of solidarity with each other and that kind of thing. They often will kind of morph into those VCSE groups, but there are a lot of barriers even to forming yourself into those groups. Like you have to jump through a lot of hoops in order to get funding, in order to set yourself up as we've got so many different structures that you might want to be. You might want to be a CIC, all sorts of like strange kind of things that you might not ever have heard of if you're kind of new to this world. So I think there's a lot to be done about like capacity building for these types of groups, so they can get access to funding to actually like do their jobs a lot more. But I think once they actually get there and they are established in this sector, again, they do face similar barriers to even the people who are trying to get set up. So it's like funding, for example, these people know their communities a lot better than, you know, a local authority, let's say, to speak, but often they aren't brought into the room, or if they are, it's a little bit tokenistic, so they'll be brought in and you know, oh, give us your view, and then it'll be like, okay, great, now go again. We won't do anything about it, kind of things. I think it's about like sharing that power on a local level and making sure that people in local authorities know and value the groups that are working embedded in the communities and know what their needs are and know what the realities of what they're facing is, rather than it being very kind of far removed when it gets to all the important decisions being made at kind of a top-down level. So there's a lot to say for co-production, you know, like people in this sector trying to get a seat at the table and trying to get themselves involved in decision making, but that obviously needs the people on the other end of it to value them. So yeah, I mean, in terms of how they get to where they want to be from where they are now, it's for me, it's just all about kind of collective power and that collective voice, and making sure that you kind of, I don't know, there's a lot of power in getting a lot of people together and trying to lay out a kind of roadmap for change and actually just like doing that work, but also acknowledging that, you know, people are doing this often in their spare time, and it's not their full-time kind of occupation or whatever. So I think there does need to be a lot more top-down support of those groups. But yeah, anyway,
well, we didn't set that up as an advert for National Voices, but that's what we try and do. So if anybody wants to become a member, membership at nationalvoices.org.uk, please feel free. Maureen, organisationally, what do you get? What are big challenges that sometimes come in your way that you find hard to get around as an organisation?
As an organization, I think the only thing that is lacking now is the provision of opportunities. For instance, now we are working towards a combined agenda, towards something that we need to be changed. But normally as an organization, because I think maybe sometimes it's because of the word African Health Policy Network, you understand? So you find that there is less things that are expected from you guys, so much that you are not included in some of these dialogues. And yet we have the people, we have got the resources that needs that help. So the best thing, the best practice, actually the best outcomes are always found by us working together as a team. You understand? Even putting resources, be it financial resources. I mean, for instance, we've got Ensan, they really pulled us out from down there where we couldn't even speak. We had a lot to share, but we didn't have the opportunity, nor the background, nor the platforms to share. And now that we are here, we are making I'm just representing actually a quarter, maybe a drop in an ocean of the voices of the people that are living the experience of poverty and mental health, you understand? So if you don't provide these kind of opportunities, the problem is, at the end of the day, we'll keep going through the same problems, until we get old. Some of us will be getting old, but the issues that were being faced about 20 years ago, before I came into this country, are still going on right now. Why? Because we are depriving other people some opportunities to speak out. The communities need to be held. These are the people, they need to be heard, whilst they influence by, policy, by informing policy, what is going on, how they are feeling it. And that's why we are here now, to work with you guys. We are so excited that something positive is coming out from this meeting, especially today. By the time we leave here, we'll be having positive minds. Good.
Yes, I'm all for that, and I hope everyone else is too. Andy, I'd like to ask you a slightly different question. It's something that Maureen's just touched on there. It's this sense of policy. This morning in our first session, it was quite clear the relationship between the electorate, the public, the government, who create legislation and shape policy in the way that they can influence. How do you see that relationship between the messages that you've got at the Centre for Mental Health and the public, who have a different feel for what you're talking about? In some ways, think Joe Bibby said that you can't underestimate how much people aren't actually engaged with inequity because they have other things that are taking up their time.
Sorry, I didn't hear that too well, but I think I got the gist of it. Yeah, I mean, I think it's really interesting. I don't know if anyone is on Twitter today and saw over the last couple of days the graph that shows that the public have very much changed their mind in terms of the value of social security benefits. That 5 years ago, there was a predominant view that benefits, particularly means-tested benefits, are too high, and very few people thought they were too low. Over the last 5 years, that's completely flipped, and something like 35% of the public now think benefits are too low, and only 15% think they're too high. So I think some of the reality we're living through, and it's not just a COVID thing, that this switch in people's opinions happened before the pandemic. So I think there is now a broader understanding that the policies of austerity, the policies of reducing the value of social security benefits, of increasing economic inequality, do actually do harm to health. And I think that's something that you know we can all work with, and we can all lobby politicians of every possible political persuasion who are in positions of power at the moment that this is a popular agenda. This is something that people want to see. That reducing economic inequality is the route to improving mental health. One of the good things that's happened over the last 10 years is that mental health as a topic has gone from something that politicians would dare not talk about, or if they did, they talked about it in pretty awful ways that we'd rather they didn't, to something which is now seen as a social good, that promoting mental health and improving the lives of people with mental illness is now regarded as something that governments are held to account for. We might actually, as people that go to post our ballots, actually think about the public's mental health when we're making our choices. And that's a really big change, and it's one that as organisations that are active in this space, even if you're not solely a mental health organisation, that's something we can all really work with, and I think that hopefully will bring about a change longer term, as well as some immediate fixes.
It's interesting, isn't it? Because we talk about the change in the conversation, or the way that governments or statutory bodies or the public talk about mental health. But Maureen touched on earlier that the depth and the profound discomfort of stigma, and how people obviously avoid that. Maureen, what do the communities you work with, how do they approach dealing with that stigma of mental ill health and poverty and the other pressures they face? What can organisations and other people do to really, you know, get into stigma and talking about these things that people by their very nature don't want to talk about?
I think the way forward now here is to normalize mental health. Don't stigmatize it. Talk about it every now and then. I mean, stop stereotyping, really. I mean, we've got some other categories, some other communities that feel like people living with mental health are a certain kind of people. Let's normalize this. Let it be, use it on media, wherever. Let's not wait for Mental Health Day to talk about mental health. Let it be a subject that is spoken about every now and then. And then let's work with the people living with mental. I believe even now, I'm in my 60s now, really, I have a level of mental health in me. Anxieties, panic attacks, all those are kind of levels of, mental health. So let's talk about it. Give me the platform as well. Let me be listened to as well. Let me impact the decision making by also involving my story in there. Then people will understand. That's the only way we are doing. We bring them together in focus group, we talk to them, we laugh with them, we do some other extra activities out there so that they feel like they are part of the society, the part of the community, and there is nothing peculiar about them. By so doing, talk to them every now and then, call them, make video calls, encourage them to come out. Yes, these days there is so much, too much about the pandemic, but it's even worse now because they are isolated now. They are scared. So this is time where we chip in as AHPN. We talk to them, call them, engage with them, activities, you know, just make them feel better, even though there is the monster out there, but they feel like they are part of everybody else. Let's normalize mental health.
Yeah, I like that. I mean, there's a degree of bravery that needs to be applied there, doesn't it? So that people enter into difficult territory, which is really good to hear. Amy, we've had a couple of questions. We've had lots of questions. I'm trying to weave them into our conversations, and I have been doing for a few minutes now. Amy, we've had a question about co-production, about how to avoid tokenistic co-production, and I assume we're talking, for anybody who doesn't know this particular word, about collaboration between organizations and between people. How can it avoid being tokenistic? And I'd like to change that question very slightly to, can you give us an example, a really positive example of co-production, and talk about how that really cuts through? Bearing in mind, we've got about 10 minutes to go, and we'll need a couple of minutes to talk about our lovely word cloud.
Sorry, just getting myself off mute. So in terms of, I mean, I will just plug Enson's work on co-production. So we have this thing called 4PI, which basically gives 4 key kind of principles of co-production to make sure that it's not just like consultation. You're not just being like, we've made these changes, what do you think of them? Because that's not co-production. Into kind of the realms of like shared decision making and making sure it has an impact and that kind of thing. So I mean, in terms of like a particular example of co-production like actually working, there I probably don't have time to like give a proper example with the time we have left, but I'm just going to put a link in the chat to our case studies for the 4PI involvement. So they include like big organizations or mental health trusts, for example, where they have followed our kind of principles of proper co-production to kind of involve service users in making changes to the programs that they offer, whether that's around like recovery or that kind of thing, because often they're created without the service users like actually having any input into them, and research shows that having, you know, being able to play a part in your recovery or whatever it is that people want to call that does lead to better outcomes. So I am just going to put a link in the chat to a 4PI thing. I would really encourage people to have a look at that if you are interested in co-production and that kind of thing. I think what's important is where it works well, and examples where it has worked well. The expert by experience, or whatever it is that they're called. Sorry if I'm muffling my mic again by moving my hands around. Get too excited. Yeah, it's where people have been valued, so paid for their time, not just bringing people in and being like, yeah, can you please do some labor intensive emotional work for us, talk about painful experiences you've had, but then we're not going to pay you for your time, we're not going to bring you back, that kind of thing. That all makes it feel more tokenistic and more of a tick box exercise. So it's about like organizations really valuing the people that they bring in to do co-production, for example.
Super, thank you so much. I'm going to ask for our lovely word clouds to float across our screens. Hopefully that can happen. I think it's, I feel a cloud coming on. So where does our focus need to be to support people with poverty and mental health? That's more of an eye, isn't it? It's sort of staring at us there. And obviously the bigger words are the ones that more people put down, and we see community and housing and education funding, which always comes up, obviously. But again, empowerment and communication and family benefits, support, living wage and empathy. We can all see the picture, I think, that's developing there around the core principles of security for people. And that would be obviously a big takeaway for us all who don't work specifically in this area, but for people who do work here, obviously, I suspect this is something that they're well aware of. I mean, I'm I'd like to ask everyone just to finish very quickly, 1 minute sort of sum up. On the last day of our conference, we'll be talking about the future. So I'd like to ask each of our panelists today a quick look into the future. What would you hope to see on the nearish horizon? And I'm going to start with Andy, if that's okay.
Sure, why not? I mean, I think first of all, we need to see absolute commitment at every level to mental health equality, and everyone doing their part, because together we can actually make a difference here, and clearly being led by lived experience and not just thinking that clever folks sitting around tables can sort this all out among themselves. And in a longer time horizon, I think we really can make a difference by tackling some of these bigger social and economic inequalities, and we've got to make a start. We can't just wait around for the right time. We need to make the right time now.
Thank you. Maureen, the nearish future, what would your hope be?
I would really love to be listened to. I would really love to be given the opportunity to be understood. I would really love to have my testimony influence change, and as well as inform policy. Thank you.
Thank you, Maureen. Amy.
Yeah, that was great, you guys. Yeah, I think I obviously echo that. I think in the very nearish, I mean, tomorrow future, we've got the budget, which I would love to see increase benefits for all, and you know, be a bit more radical than it probably will be. So that would be great. You know, support for renters and that kind of thing. I think coming out of the COVID crisis, I hope that people have a bit more kind of humanity for each other, and a bit more of an understanding where they might not have before of what, you know, we are all in the same storm, but we're not all in the same boat, that kind of thing. Like, people understanding that while we've all had a bit of a rubbish time right now, there are people who have had, you know, things that have made it even worse for them. And it would be great if people came out of this with more empathy for one another, and also more drive to get involved in all these wonderful things we've seen around community action and mutual aid and things that really improve mental well-being but aren't even that focused on it. So I'm hoping that we're moving towards a more inclusive and, you know, caring society for everyone. Yeah, I'll stop there, otherwise I could just go on for like 3 days about that one.
Great stuff, guys, and the chat is buzzing away, and debating universal basic income, and talking about the differences that can be made in housing and community, and the stigma of mental health and destigmatizing and things like that. We've had a ton of stuff in the chat. Got a lot of questions that haven't been answered, so I apologize for that. I think that's a sign of an energized session. I really thank you for the panelists for coming on. That was really, really interesting, and I hope it worked for people who are attending as well. We've got a really interesting session coming up at 2:15, using partnerships and peer-led approaches to tackle health inequalities, on the same link. So that's a collaborative session between the Patient Experience Library, Turning Point and Groundswell. That's going to be a really good one as well. So I thank you for your support. Obviously on the Twitter, on our website, there's lots of details about the other days of our conference. They're always on a Tuesday for the next, so that's the 2nd, the 9th, 16th and the 23rd of March. If you want to register, all the details are there. And we'd love to have you along for the rest. And if the first 2 sessions are anything to go by, we're going to cover a lot of ground, and it's going to give a lot of challenges, but we've then got to plan a way forward, because no one wants to see just words. We want to see actions as well. So thank you again, everybody, and I think we'll draw that to a close.
Thanks so much, everyone, and thanks again for having us.
Thank you.
Thank you.
Cheers.